Okay, we always look forward to this Tuesday morning virtual house call. Joining us live this morning, Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. We always appreciate the time, Dr. Bogoch. I wanted to start here this morning. The latest data from the Ministry of Health shows that COVID rates were rising in the last week. There were 5 deaths, high test positivity rates, and hundreds of beds once again being filled by COVID patients. At the same time, though, vaccines are harder to get in this province. So, are we in for a wave of COVID? How are you and members of the infectious diseases community kind of preparing or sort of looking at this?
Yeah, certainly. I think it's important that we're aware that COVID is still circulating and it's out there. And sadly, I mean, no one wants to think about this, but there's going to be more of it as we move through the fall and into the winter. We're going to see COVID predictably rise every fall and winter. We're already starting to see that trend right now. We know vaccines are on the way. So we know that these updated vaccines are going to be coming soon, but they're not here. They're probably going to be ready in Ontario probably by October. It's also important to recognize, too, that flu season is on our doorstep as well, and we're going to start to see cases of flu emerge probably sometime in October and really in November, and to be prepared for that as well. It's respiratory virus season on our doorstep. We know that the vaccines will be available soon. Of course, we know through 5 years of COVID, ways to mitigate and reduce the risk of illness. Some people will choose to put on a mask in an indoor setting. Despite all the BS that is amplified on this topic, we know if you put it on a mask in an indoor setting, you're going to reduce your risk of getting an infection in that setting. And we know that improving the air quality in indoor settings can help reduce the risk. And of course, these vaccines do a good job as well. Yeah,
good to hear you calling out the BS, Dr. Bogoch. In the meantime, it's almost like I sent you the questions in advance, which I didn't, although people suggest that I do sometimes. But I wanted to talk about, the flu. Flu shots are going to be rolled out, like you said, in the province next month. Here's the thing, because we are here, I guess other parts of the world get the flu before we do, they've sort of seen, how it's rolled out, what the sort of vaccine is looking like. So how's it worked out in other parts of the world? And how do you feel about the confidence level in this year's vaccine?
It's hard to say. The flu, we always say, is predictably unpredictable. And looking at the Southern Hemisphere is a good metric, but not a perfect metric for what we're going to see in the Northern Hemisphere. Because as all viruses do, the flu virus mutates, and we can roughly judge what we're going to see. In the Southern Hemisphere, they had a fairly standard influenza season in many parts of the Southern Hemisphere. Perhaps that's what we'll see again this year. It's impossible to know what the match is going to be like with the upcoming flu vaccines because the virus does change. Some years it's pretty darn good, and of course it's not perfect, but it will reduce the risk of infection and mitigate severity of infection if someone does get an infection. We'll probably see something like that. The real question is, what is the effectiveness of the vaccine this year? And you know what? The only way we're going to know is post hoc analysis. We'll know in April and May how the vaccine performed November through March.
Yeah, and I suppose the big part of it is how many people actually take it to sort of get that level of prevention up. Here's another interesting thing. I always like going through your Twitter feed or X feed, whatever you want to call it, Dr. Bogoch. You tweeted about something called oropouche, I don't even know if I'm saying it properly, fever. We now have 1 confirmed case in the country, but you sort of added that there are likely more cases. So what is this? Do we need to be worried about it?
Oh, I'm really glad you're bringing this up. Yeah, oropouche virus is a virus that's been known to exist since the 50s, initially discovered in Trinidad and Tobago, but really has outbreaks periodically in the Amazon region. But this year's different. This year, there have been big outbreaks well outside of the Amazon region in parts of South America and even in the Caribbean, for example, in Cuba. And there have been a bunch of people who have been infected with this virus and returned to their home country. People who have traveled to Cuba, for example, have returned to Spain, Germany, United States, Canada as well. It causes a dengue-like illness. So fever, headaches, muscle aches, and pains. The vast majority of people recover with no issue whatsoever. It's transmitted by certain types of insects called midges and sometimes mosquitoes. Here's the thing. It's not entirely clear, but there's a possibility that this can impact pregnant women and the unborn fetus. And remember, in 2014 and 15, we saw the Zika virus epidemic unfold where that was initially discovered. It's not entirely clear if that would happen with oropouche virus, but it may, and that's why the Public Health Agency of Canada said, hey, there's this virus out there, be cautious, take some mosquito repellent and insect repellent with you to prevent infection if you're traveling to these areas. They're unknown questions, that are being addressed. And I think we'll learn, sadly, but it's a double-edged sword. We'll learn a lot more about this in the months ahead.
Okay, glad I asked the question this morning then. Okay, that is Dr. Isaac Bogoch. We always appreciate the time, Dr. Bogoch. Have a great week. We'll see you back here next week.
Thank you so much.